As the leaves turn golden and a chill fills the air, a familiar threat looms: respiratory virus season. But this year, there's a twist. While the U.S. Centers for Disease Control and Prevention, CDC, predicts a similar surge in hospitalizations for COVID-19, flu, and RSV as last year, the approach to vaccination has shifted. And this is the part most people miss. It's not just about preventing illness, but about preventing severe illness that lands you in the hospital. Here's the deal. Vaccines are your best defense against these viruses, but the CDC's recommendations have evolved. This year, they're emphasizing shared decision-making for the COVID-19 vaccine. This means consulting with your healthcare provider to weigh the risks and benefits. Controversially, this marks a departure from previous years' blanket recommendations for everyone to get vaccinated. Dr. Dan Barosh, director of the Center for Virology and Vaccine Research at Beth Israel Deaconess Medical Center, explains, "The difference this year is that there's not an explicit recommendation by the federal government to get the booster. This shift raises questions about individual responsibility and the role of public health guidance. Should vaccination be a personal choice, or is a stronger push from authorities necessary to protect public health?" Here's what you need to know. COVID-19 vaccines, updated versions targeting recent strains, are available for those 6 months and older. Consult your doctor to decide if it's right for you. Flu vaccines, recommended annually for everyone 6 months and older. Aim for September-October, ideally before Thanksgiving. RSV vaccines, recommended for adults 75 plus and those 50 to 74 at high risk. Pregnant women can also get vaccinated to protect their newborns, but here's where it gets even more interesting. For the first time, a nasal spray flu vaccine, FluMist, is available for self-administration at home in 34 states. This convenient option expands access but also raises questions about self-diagnosis and proper usage. Beyond vaccines, don't forget the basics: hand hygiene, covering coughs, adequate sleep, a healthy diet, and avoiding crowded indoor spaces are crucial for preventing the spread of respiratory viruses. The bottom line: respiratory virus season is here, but you're not powerless. Vaccination remains a powerful tool, even with evolving recommendations. Talk to your doctor, weigh the risks and benefits, and make informed choices to protect yourself and those around you. What do you think? Is the CDC's shift towards shared decision-making for COVID-19 vaccination a step in the right direction, or does it leave too much room for individual interpretation during a public health crisis? Let's discuss in the comments.